Today we'll discuss beta blockers with intrinsic sympathomimetic activity or beta blockers with partial agonistic activity. These are the beta blockers with partial agonistic activity or intrinsic sympathomimetic activity. First of all, we'll see the drugs like S-butylol, alpranolol, bipindolol, carvedilol, celiprolol, carteolol, then labetalol, pindolol, penbutylol, and oxprenolol. So these are all the drugs. They possesses the partial agonistic activity. These are the beta blockers with partial agonistic activity, or we can say they are having intrinsic sympathomimetic activity. Now, what is mean by this intrinsic sympathomimetic activity or partial agonistic activity? Means they are partial agonist at the beta 1 receptor. We know that they are the beta blockers, but they will also act as a partial agonist at beta 1 receptor. Partial agonist means they have submaximal intrinsic activity. They have submaximal intrinsic activity at beta 1 receptors. Apart from having beta blocking property, apart from having beta blocking activity, they have partial agonist. They will act as a partial agonist at beta 1 receptors. That's why they will prefer in patients those who are more prone to develop severe bradycardia with beta blocker therapy. Those in this beta blockers are preferred in patients those who are more prone to develop severe bradycardia with beta blocker therapy. Now, as they are having additional beta 1 agonistic property or partial agonistic property, what does that mean? They will stimulate the heart. Means there is a stimulating action on the heart, and because of its stimulating action on the heart, there is no bradycardia. Means normally or generally what we can see with beta blockers, what is the main adverse effect? Bradycardia is the main adverse effect of beta blockers. But all these drugs, S-butylol, bipindolol, carvedilol, celiprolol, carteolol, labetalol, pindolol, penbutylol, and oxprenolol, because of its partial agonistic activity at beta 1 receptor or intrinsic sympathomimetic activity, what does that mean? They have stimulatory effect on the heart, and because of its stimulatory effect on the heart, there is no bradycardia. There is no bradycardia. And these beta blockers are contraindicated in angina pectoris. Why they are contraindicated in angina pectoris? Because they may precipitate myocardial infarction due to stimulation of heart. So these beta blockers are contraindicated in angina pectoris because that may land up into myocardial infarction due to stimulation of heart. But the one advantage of this beta blocker, they do not have bradycardia as a side effect because of its beta 1 partial agonistic activity, and that's why they will stimulate the heart by acting on beta 1 receptor.